I'm pretty sure you have all heard horror stories about the wisdom teeth, especially the lower wisdom teeth. Sometimes these teeth are not coming straight, they're coming with different angulations there, and because of the position, they will suffer from constant infections there, or because of the position of the tooth, it might cause some cavities to the teeth next to it. There will be indications for us to intervene. I will have referrals from general dentists to see patients with problems with their wisdom teeth, upper and lower. That will need initially a consultation to know what is really the problem there, examine and realize where the tooth lies. That we will need one basic radiograph, that's an OPT, that's a panoramic radiograph, that will allow us to see the tooth morphology in relation to a nerve which is running in the area. We all have that nerve, we're not unique, but sometimes that nerve can be closer to the roots of that tooth. And in that case, we might have to do a 3D scan that will allow us to know a direct position of the nerve and to the tooth. We do have that 3D scan in place, so I'm able to provide that straight away and explain to the patient what we will do. Most of the times, if the tooth is covered by the gum and the bone, that will involve doing a trapdoor, moving the gum back, allow us to see a bigger part of the tooth, expose the tooth a bit more, and then to avoid traumatizing the teeth next to it, we have to cut the tooth in smaller pieces to take it out in a smaller part, not putting lots of pressure to the surround tissue around it. Following that, we will clean the area. We will add sometimes some LPRF as well to promote the healing there, and we'll put a couple of stitches that they will be dissolvable stitches most of the time. These stitches, they will lie there for a couple of days to a couple of weeks. We will also arrange a review appointment for our patients to see how they are following that. It's a procedure that you will need to have some painkillers afterwards, but nothing very special. So ibuprofen, paracetamol will be more than enough. As a patient, you will need to be aware that you can't go outside and have a burger. So you need to have a bit of a soft diet, not baby liquid diet, but soft diet. And it's very important to keep things nice and clean. So we'll advise our patients to have some mouth rinses, gently clean the area there as well to avoid any infections afterwards. Main complications that you might have from that, again, it will be an infection, which can be prevented, as I said, by making sure that you follow your hygiene there. We tend to call our patients the day after and have a review appointment. So if there is any complication, we can catch it sooner than later to avoid any problems. The procedure could take place either under local anesthetic, so that will mean a couple of injections, so your mouth will be numb, you'll not be able to feel any pain, but you will hear what's happening around you, and you might feel some pressure. People, they are not extremely anxious regarding having any dental treatment, they will be okay with that. So that will take around an hour. Following that, you'll be able to go home, and you just need to have a couple of days a bit more relaxed. So if you are a person who like going to the gym, go for a run, I would say take it easy for a couple of days. If on the other side you're a bit more anxious regarding any dental treatment or even having a tooth out, so I'm pretty sure everyone will look things on YouTube and will be petrified, we are able to provide sedation, which could be a medication that will go through the veins that makes you feel a bit more sleepy and more relaxed, or having a couple of drinks and you don't know what's happening around you. And in that case, we make you, as I said, a bit more chilled and relaxed during the procedure. So you might not remember things. The procedure in the mouth is the same, but it takes that anxiety away. What extra things you have to look at as a patient is that you're taking an extra medication into your body, a safe medication into your body. But on the other side, that medication, as I said, it makes you feel a bit more sleepy and more weak, I would say. That medication most of the time stays into the body for 24 hours. So that's why someone needs to be with you while you're having the procedure in practice, and then take you home afterwards and look after you for 24 hours to make sure that you'll be stable there. Apart from that, the recovery process for any extraction, especially for a wisdom tooth extraction, it would be the same.